Hi everyone, welcome back to Chai and Chat with Neha. And today with me on a popular demand, we have Dr. Pinakin Parekh again. And Dr. Parekh, before I say anything, everyone told me that, oh, you should do more episodes with Dr. Pinakin Parekh. Like, that was such an amazing information out there. And see, you are here on the popular demand
Thank you, Neha, for having me
again.
back. I thought you forgot me. You've become so popular amongst the circles, and you've gotten other people on your show. I was wondering when's my turn to come back on. So much to talk about.
Yes, yes. And today we are definitely going to talk about more in terms of what's going out there, what is common in the medical side of things. And before we start, are you still drinking cold water or
No,
the drink
after
has
after
changed?
after listening to your programs, I've started drinking chai. Yeah, I still do, but a bit of chai every now and then helps calm the mind.
Okay,
Yeah.
okay. Nice to hear. All right. So today's topic, and let's start with that. We are going to talk about high blood pressure, which in medical terms it is high hypertension. But for the sake of everyone's relatability, we'll keep it high blood pressure. What
We can
is
go
high
we
blood
can
pressure?
go even simpler for everyone's relatability. We can say high BP, right? That's what
High
people
B.
talk about. My BP is high, my pressure is high. So all of it means the same thing. It all
Okay.
means that the force exerted by the blood in your circulation of the body on the walls of your vessels is too high. Pressure. We learn pressure in science, right? Pressure is force over area.
Yes.
So that is essentially what high BP is. Very easy to ignore. High BP, it's okay. Nothing's going to happen, but it's a big cardiovascular risk factor and dangerous.
Wow. Oh my goodness. Okay. Yes. And it's one of the very common diseases out there today. Is that correct?
Yes, it's quite prevalent, and the paradox of it is a lot of people don't know that they have high blood
Mhm.
pressure because it's a silent disease. There's no physical manifestation, and there's no real symptoms that you feel unless, of course, your blood pressure becomes super duper sky high, 100, That's when you might start feeling a bit of headache, a bit of giddiness. But for the vast majority, it's going to be high, and you can go about without even knowing it. And that's why we call this in a medical circle. I don't want to be morbid on your show, Neha. I know I'm trying to uplift everyone's spirits here, but we call it the silent killer. It's silent, it slowly causes progressive damage over the years.
All right.
It can start in your 40s, and by the time you realize that you have it because you never bothered to check. Maybe you had gone to a friend's house, he had a BP, you play around it, the machine, and you noted you have
Okay.
it being high. So you can have compounded problems over the years and leading to some disease manifestation across the whole body.
Got it. So let's say if somebody checks, like how you said, like somebody is going to friend's home, they are checking. At that point in time, it's coming high. But is it always possible that could be possible that he was doing something? Because when we run, our blood pressure increases, right? So he might be playing, but seeing that, that could be a false positive.
Absolutely. Absolutely. So I think there's a clear definition. If you look in the guidelines, how do you measure blood pressure? So you need
Mhm.
to be rested. So first thing is you need to be rested. You cannot be measuring your blood pressure when you're talking to somebody, when you're fighting with somebody, when you're angry or you're worried. So you need to be in a room by yourself, ideally. That's how they describe it. You cannot be
Okay.
lying down on the bed and things like that. You need to be seated upright, both feet
Okay.
on the ground, hand on the table, kind of in the same level as your heart. And then you measure your blood pressure. And typically it's the
Okay.
best of two or three readings.
Got it.
So, I find that a lot of people who come to a doctor's office, their mentality is already changed. They are worried about a doctor. So
Yes.
psychologically, the blood pressure can go high. So I
Right.
generally never try to diagnose anybody with high blood pressure in a doctor's office because
Okay.
I've had situations where patients have a blood pressure of 180, 190 in my office. And then, I always tell them, don't worry, I'm a nice doctor, don't worry. But still, you cannot control your nerves. It's involuntary. So, but when they go back home in the comfort of their house, it settles down without any medication. So that's a true reflection of the blood pressure. Because if I
Got it.
start treating them with medications based on what I see in the office,
Mm-hmm.
if they go home, the blood pressures will go down even further because they're medicated now. And then they can start having complications. So best way is to measure in the comfort of your own home.
Got it.
And you need to keep a diary. You need to keep some book, some
Okay.
reference, because most people don't remember the values. So they will come to a doctor and I'll ask them, what's your blood pressure? And then they'll start to try to guess a number from the skies. So if
Yes.
you write it down, it gives you a trend.
Got it. Okay. And doctor, you said that we should take it like in two to three times where we can gauge how it is going. Could stress also cause high blood pressure? Because I've seen my dad. So whenever he's in stress, like his blood pressure shoots up. So even if he's going to give, let's say, a blood test,
Yeah.
like he starts panicking. So again, is that a false positive as well?
So that's a bit tricky because, yes, we do tell patients if you manage your stress, your blood pressure can get better. And if you
Okay.
are totally stress free, maybe you're on a holiday, you take your blood pressure, it's going to be okay. Yes, of course, you don't need medications. But realistically speaking, if you, when the day starts, your blood pressure is okay, and then the whole
Mm,
day you're stressed, stress, all the way to evening, and that's the only time your blood pressure is going to be okay because you're supposed to do in a silent, comfortable room.
got it.
But your pressure is high throughout the day, so that's not helpful either. So I think we need to be
Got it.
realistic, and sometimes I do give patients medications to help reduce your blood pressure during stress because you are trying to ease out the fluctuations and gentle the curve and not ride so high in values.
Okay.
But
Okay.
apart from stress, there are a lot of other factors that can cause high blood pressure. A lot of other
Got it.
factors.
Okay.
Do you want me to share, or
Yes,
what
please.
do you think? Let me ask you, what do you think is the most common cause of high blood pressure that people perceive to be? General public.
Apart from stress, right?
Yeah,
Like I have seen people telling, "Oh, don't eat too much salt."
yeah,
Is that correct?
that's correct. So I think you're talking about lifestyle. I think the big word that you're looking for is lifestyle.
Okay.
So
Yes.
lifestyle is the most common cause of high blood pressure,
Okay.
and in the medical lingo, we call this primary hypertension, primarily
Okay.
caused by lifestyle, which is obesity, lack of exercise, high salty food, high fried, oily, fatty food. But you're right. So
Okay.
lifestyle is a combination of all of this. And lifestyle typically catches up with you. You're okay in your 30s, you're okay in your 40s, but
Okay.
by 40s and 50s, your bad lifestyle catches up with you.
Okay.
But I see in my practice a lot of young people in their
Mm-hmm.
20s who have high blood pressure. And something's
Okay.
not quite in sync here because they don't quite fit the appropriate age group. So for this kind
Right.
of patients, we go beyond primary, we go beyond lifestyle, we look for a secondary cause for your high blood pressure. They can have
Okay.
in them high blood pressure as a manifestation of another serious underlying disease,
Got
hormonal
it. Okay.
problem, thyroid problems, endocrine
Okay.
problems. So thyroid hormones, adrenal, excess cortisol hormones can cause a
Okay.
problem. Kidney problems can cause high blood pressure. Sleep apnea. I don't know whether you've heard about sleep apnea, where people snore very loudly at night. There's a problem with oxygen passage down your
Okay.
windpipe. That can trigger high blood pressure.
Okay.
So it's very easy to just take medications and bring their blood pressure down, but that's just
Right.
masking the problem. You don't uncover the underlying truth. And that's what I do actually when I see such young patients.
Right. So how do you diagnose such kind of patients?
Yeah, so they go through a battery of tests. So I warn them,
Okay.
most of the time this test will come back normal,
Mhm.
right? But we do a few tests. So some of them include blood tests to look for hormones. Some of these hormones are not found via blood tests, they're found via secretions in the urine. So I do a
Okay.
urine test, and some of these urine tests is involving 24-hour urine collection. So one whole day,
Okay.
every single
Wow.
drop of urine you pass into a bottle, and we look for concentrations of the hormones. And then we
Okay.
also can have ultrasound of the heart and ultrasound of the
Mhm.
kidney to look for kidney problems.
Okay.
But the number one cause of secondary hypertension, the number one cause of non-lifestyle is still sleep apnea, snoring at
Okay.
night. So if your partner tells you, hey, my person snores a lot, you have to be a bit suspicious. So you have to be suspicious, and we have this thing called sleep study. So
Okay.
it's done in the comfort of your home. Nowadays, we have portable devices where a vendor comes to your house, they put an oxygen probe on you, they put a small stick on your chest, there's a small cuff on your wrist where you can measure your oxygen levels at night. It might drop when you stop breathing for a few milliseconds. And then we can look at chest movements, and we look for some criteria to diagnose sleep apnea. And if you have that diagnosed, sometimes to treat your blood pressure, you might need a sleeping aid at night to help your oxygenation and your breathing patterns at night.
Okay.
Yeah.
Wow.
So
Okay. So there is.
we do pick up, most of the time it comes back normal, but sometimes some surprises are seen,
Mhm.
and it does make a difference to patients.
Okay. So let's say if somebody is in their early 40s, so and their lifestyle doesn't look too bad, like by just looking at them. So how do you go about, like, is it primary or is it secondary?
Correct. So the first thing is, of course, looking at their body habitus and asking them about their diet history, and
Mm-hmm.
family history does play a small part also. If you got parents with
Okay.
high blood pressure, there's a higher tendency that you might have, but it's not as strong as cholesterol. Cholesterol has a greater genetic determinants to that.
Okay.
But there are a few factors. So young age is one of them. And even if, let's say, you are not young, you're 50, but
Okay.
if you require suddenly, let's say your blood pressure is well controlled 1 year ago on one
Mm-hmm.
medication, suddenly out of the blue, you suddenly need 3 or 4 medications to control what was easy. Then something
Okay.
else is going on. Your diet has not changed, your weight has not changed, you are compliant to your medication, you're very good behavior, but still something's going on the opposite end of the curve. That's where we need to hunt for a sudden new development. So it's a bit of a
Got it.
judgment, a bit of judgment.
Okay.
Of course, I try not to do a wholesale package on anyone who comes in. We do the whole test. So case by case. But I think if you're young, less than 40, with high blood pressure, with a good body mass index, good BMI, reasonably good diet, we might need to hunt just
Got
to be
it.
sure.
And is it true, doctor, that if we start on blood pressure medication, we have to be on it for the entire life? Is that true?
Yeah, and that's a very important question. I'm happy that you echo that, because that is the single most barrier for someone to start a blood pressure medication. Most patients are okay to start the blood pressure medication, but their
Okay.
upfront worry is, oh my God, if I start, I'm hooked for life. And I always give hope to my patients. The moment you tell them that yes, it is for life, they are not going to start the medication. And even if they start the medication, they are not going to come back to you because they're going to find the next doctor who's going to tell them something different. So the answer is actually yes, you can stop your medications. But you must bear in mind that if you stop your medication, there is a chance your blood pressure can go back to where it was as if you're not
Okay.
taking your medications. And especially if you've not done anything else in your lifestyle to correct
Mm-hmm.
the reason why you had high blood pressure in the first place. So if
Got
you
it.
take the medicine, it's very well controlled, and then you decide to stop it one day, it's not
Mm-hmm.
as if your blood pressure will remain such forever, right? This is not a cure. So I like to say this: these medicines are not curative. They don't cure your blood pressure. It's not a 5 day, 7 days course of antibiotics. It's a control.
Sure.
Once you release the support, once you remove that, the blood pressure goes higher, unless you've done something dramatic in your
Mm-hmm.
intake exercise regime. Or the secondary causes, which I've done a battery of tests, has been found and has been corrected. Hormone replacement therapy has been done. A tumor that's producing extra hormones has been surgically corrected. Or you got sleep apnea, your tonsils are very large, maybe the septum is deviated of your nose. All that has been
Right.
corrected. Then your blood pressure medicines can come off without any worry that much.
Okay. Got it. So some patients I've seen, they say that, oh, I'm doing everything correct. And without doctor's note, they just go off with the medications.
Yeah,
Is that
so they can go off, but they need to make use of your blood pressure medicine, the blood pressure machine which is at home, and
got it?
measure and trend it again, and
Got it.
and don't go off the radar. You need to be under the
Right.
radar to make sure things are okay.
Right. Right. So, do you think, doctor, high blood pressure can cause more things? So, let's say if, like you said, it goes mostly undiagnosed, right?
Yeah,
So, can it start showing some other symptoms like manifesting into something else? So, right now we were talking about something else manifesting into this. But let's say if somebody has stress and high blood pressure, can it manifest into something
yep,
else?
yep. So good point. So uncontrolled blood pressure will lead to problems in a lot of body parts. Everyone
Okay,
thinks about heart attack. So if your blood
right.
pressure is very high, the blood supply in your heart can develop narrowings, and that
Okay,
can cause heart attacks. And the same structural changes can happen in the brain, and that can cause a
okay,
stroke. Not enough blood
okay,
supply because of narrowing of the blood supply to the brain. If the blood pressure
okay,
is too high, it can also cause another type of stroke, which is a bleed in the brain. It's too high. The pressure just becomes like your water pipe at home. The pressure in your pipe is so high and the pipe bursts. So if the burst happens in the brain, you can have a bleed in the brain. So that's a hemorrhagic stroke.
okay,
And if the stroke is just purely due to a narrowing and lack of blood supply to the end destination, that's a non-hemorrhagic stroke. That's an infarct, lack of blood supply. But
okay,
there's so many other places. It can affect the kidney. It can cause your kidney function to become poor and can affect
okay.
your blood test results of your kidney. And some people uncontrolled can even develop dialysis requirements because of
Oh, wow,
kidney
okay.
failure. So it's not always diabetes. Even high blood pressure can
Mm,
cause that. It can cause changes in your eyes, blurring of vision because of the small blood supply in your eyes.
okay.
So a lot of widespread implications of high
Got
blood
it.
pressure, and that's why we always breathe down on patients if their pressure is not controlled.
Got it. And what happens if somebody has a heart disease, something or the other, and they also come up with high blood pressure? So, how the diagnosis change or the medication change? Like, do we have to take care of something so that it doesn't manifest into more other
Yes,
things?
yes. So if let's say somebody has been diagnosed to have heart disease, first time in your life they ended up in the hospital with a heart attack, right? So we, of course, as an interventional cardiologist, I go and relieve the blockage. I put in a stent. I do the emergency angioplasty. But once we put in a stent, doesn't mean the cure is for life. You still
Mm,
need to do everything in your power to prevent that stent, that intervention from failing. And then we look into all the risk factors. If I notice your blood pressure is high, we've spoken about blood pressure. The typical value that we talk about blood pressure is 140/90. There's a
okay,
definition, 140/90. So if it's above that, then we try to give you medications to bring it down to about
okay,
120/70,
okay,
and keep it that way for a long, long time to prevent further progression in that stent or any other areas where there is some disease but it's not progressed to the point you need a stent, but we want to prevent progression. So
Makes
so we
sense.
just go hard on risk factor modification.
Okay.
And it's medications, right? It's medications because pure willpower can be very difficult. Pure willpower, pure exercise, pure diet might only reduce your blood pressure by maybe 5 or 7 numerical value down. So if you're, let's
Okay.
say, having a blood pressure of 150, 160, even if you
Mm-hmm.
exercise from 160 brings down to 150 is not good enough. We want it to go to about 120. So medicines are
Okay.
important.
Got it.
And medicine's a whole big topic because there's so many different classes of medications. There are 5 or 6
Mm-hmm.
different families of blood pressure medications. Some work
Oh,
on the
okay.
heart, some work on the kidney, some work on the arteries, all to reduce blood pressure.
Okay.
And the current guidance is to go in with 2 types of medications working on different pathways to
Okay.
control blood pressure. Instead of taking
Okay.
one type and making it maximum in dosage, you go with
Mm-hmm.
2 different types with moderate dosing to use a
Okay.
synergistic effect to bring down blood pressure. It's been proven.
Got it.
Yeah.
Okay. Wow. I mean, such important.
It's good that we talk in depth, it's very useful.
Yes, yes. And just thinking in terms of people who are young and for some reason they are developing this blood pressure, high blood pressure in their life. What are the takeaways? Like, are there any misconception out there? Like I'm young, it cannot happen to me, or like, oh, I do workouts and I'm eating fine. Like, are there any misconceptions out there that you know
Yeah, yeah,
of?
many, many. Once you run clinics, you hear a lot of misconceptions, and you can relate to them. Number one is, yes, it's young. I'm young. It can't happen to me. Number
Yes,
two, my blood pressure is high. It's okay. I don't need to check. The only time I need to check is about 6 months later when I end up with a doctor. He's going to guide me then. That's not true because you need to check and make a decision whether you have it high or not. You cannot wait for 6 months
right.
because you might miss diagnosing yourself early on. You mentioned about medicines. Once I start, I get hooked for life. I can't come off it.
Right.
Or if I stop my medicines, my blood pressure will become double. It won't. It won't. It will just go back to where you were at. It won't suddenly rebound to 3 times higher or 2 times higher.
Okay.
I might feel something if I've high blood pressure. Not always true. I don't have symptoms for most of the pressure elevations. You
Got
can have
it.
silent disease. And that's about it. Those are the main misconceptions.
Got it.
And sometimes some people have medication induced high blood pressure, so that's interesting. So sometimes,
Okay.
so people, I talk to patients and I take a thorough history. They choose to tell me a lot of things, but on the sideline, some people take certain medications that can increase their blood pressure. So steroids
Okay.
can increase blood pressure. So some patients who are, let's say, asthma patients who frequently
Okay.
have asthma attacks, and they have to use a lot of puffs, or sometimes they need to take tablets. So a lot of
Right.
usage of steroid can cause high blood pressure. Some
Okay.
of the nasal decongestants that use, stuffy nose, the decongestion medications can also cause high blood pressure. Sometimes
Okay.
looking into your medication history,
Mm-hmm.
if a change can be effected there, can also help with your
Okay.
blood pressure modification.
Okay. Wow. So, and I've seen that, like Arbutrol, the medicine that they use in asthma
Yes,
inhalers, it causes like high heartbeats as well, like
yes, can cause
very like.
high tachycardia, high heartbeats, and BP.
Oh,
Yeah,
okay.
but
So it.
yeah, so I think, but you don't use this every time. It's as a rescue medication. But some asthma patients need to take medicines which are chronic on a daily
Mhm.
basis. So some of them can cause a problem. Yeah.
So we can say that is it's a side effect of those medicines. Is
Yes,
that
you can
correct way to
you can call
say?
it a side effect, but these medicines are very important from the asthma point of view. We don't want them to suffer
Right.
from difficulty breathing. So it's
Right. Right.
inevitable, and we just have to solve one problem and treat the other problem that comes after solving one problem. No choice.
Right.
Yeah.
Right. So, like, for the span of time that you have been in this like medical field, have you seen the difference between how we used to treat patients before and versus now?
Yes, and the main change is we are far, far more aggressive with our blood pressure medications and thresholds to treat.
Okay.
Long ago, we were accepting a target of one. So if you have blood
Okay.
pressure 130/80, Cheliga, it's okay. But nowadays, more and more guidelines are coming out to say the lower the better. So about 120/70 is good.
Okay.
Uh, and even the combination regimes of two different medications, like I was telling you about, are far superior instead of just using one medication to help patients. But psychologically, we need to address that, right? So most patients, doctor, two medicines, no, let's do it one medicine. So one way
Right.
to overcome the psychological barrier is a lot of places now have two-in-one formulations, two in one. So in one pill, there are two
Okay.
formulations. Perception-wise, you're still taking one tablet, but inside
Got it.
there are two formulations of different classes. So that helps in the mentality of it. It's a mental game,
Right.
part of it is a mental game. You need to be convinced that you need to take the medication. You need to be convinced that the medicine is good for you. You need to be
Yes.
convinced that I will adhere to my medication. You need to be convinced that it's a long-term thing as far as you can go. And if you stop, you need to convince yourself to check it.
Right. And like coming back to like how it manifests into different diseases as well.
Yeah.
So when we are taking care of high blood pressure as well as doing other things, does diet play important role at that time as well? Like, does it help while in secondary? Let's say primary is definitely diet,
Yeah.
right? But I'm talking in terms of secondary. Would it help as well?
It would help. I'm sure these patients who have secondary hypertension, and
Mm-hmm.
if they also have a existing poor diet, so it's a two-in-one whammy.
Got it.
Both of it will be a problem. So
Mm-hmm.
if I always tell them, if you can look into your diet, try. But diet is one of those things. It's easy to say. I've been saying diet, 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 but it's a bit hard to effect for a lot of people because of cravings and temptations.
Right.
So we have to be realistic. If they really cannot change their diet, then we just have to start the medications to give them some support. It's like it's like when you go to the gym, right? You're doing a weight training. So you can't take the weight because it's just too heavy. So the gym instructor gives you a small lift. So these medicines are meant to be a small lift to help you have some improvements in your blood pressure. Maybe you don't need to change your diet so much, but you get some additional support.
Right.
Mm.
And can it also cause heart failure? Because we were talking about, how it can impact other organs.
Yeah,
So,
yeah. So so if it causes narrowing in your coronary arteries, your blood supply, that's where we talk about reduction in flow, heart attack. But
got
you're
it.
right. Some patients, the heart's a pump, right? The heart is
Mm-hmm.
pumping away. It's pumping away into the main circulation of the body. But now, if the heart has to pump against a pressure which is very high, right? Because blood pressure is outside the heart, it's in the main circulation. And the heart
Mm-hmm.
has to now work harder to overcome the high blood pressure which is outside. So
Okay.
if the heart has to go against that form of resistance, yes, the
Mm-hmm.
heart muscles can enlarge. That's why you hear about enlarged heart,
Okay.
hypertrophy of the heart, and that can cause heart failure. That can cause
Okay.
heart failure.
Oh, wow. Okay.
Yeah,
And the blood pressure, like how you were telling, like 140,
90.
sorry, 120 by
Yeah,
70,
that's right.
right?
Yeah.
So, what are these numbers? 120
Okay, good point.
and sorry.
So, the heart when it beats, there's the contraction of the heart and the relaxation,
Mm-hmm. Mm-hmm.
right? So that's why the two numbers come. So once the heart squeezes blood out, gush of blood, gets into the main circulation,
Okay.
the pump, the force.
Mhm.
And the first number means the value when that happens, the force of the blood on the walls of your arteries, of your circulation, when the heart
Mhm.
pumps. But when the heart
Mhm.
relaxes, there's nothing pumping out. There has to be some pressure remaining behind in your circulation to
Okay.
maintain function of your body, because the heart pumps and relaxes. So once there's relaxation, there's no extra gush that's coming out, but there's still some residual pressure left behind.
Okay.
Blood is still there, exerting
Mhm.
some force. So that's the second number, because
Okay.
it cannot be the first number 120 and the second number drops to zero. It cannot, because then you
Okay.
have no life at that point
Got
when the
it.
heart has relaxed to accumulate blood before it pumps out again. So both numbers are important.
Mhm.
In the elderly, typically we see the first number being higher. In
Okay.
the young, we often see the first number can be normal, but the second number can be high also. So both,
Okay.
it's called systolic, diastolic. Systolic and diastolic.
Okay. And we are talking about high blood pressure right now.
Yeah.
What if somebody has the numbers lower than like 120/70?
So I congratulate you. Well done. So I mean, yes, but again, it's relative. How low is low, right? So I think if you have
Yes.
a blood pressure about 110, 100, or even the 90s, it's okay. But if it becomes low, if it's less than 90 for the first reading, especially, and if you have some symptoms, you feel giddy, lightheaded, then we swing to the other spectrum, and we need to account for why your blood pressure is lower than usual.
Hmm.
So we need to investigate also, because a low blood pressure, uh, it can be temporarily low. Let's say you run a race, you're dehydrated, you don't drink enough water, you sweat more than what your intake is, your blood pressure can go down. But if it's perpetually low all the time to the point you're always giddy, then again you need some testing. You need a hormonal testing, and because excess hormones cause high blood pressure for
Okay.
primary example, for secondary. But those same hormones, when too little, can cause
Hmm.
low blood pressure. So we need to investigate both ends of the scale.
Got it.
Hmm.
And can it happen? Like, do we see any of these, right? Low blood pressure or high blood pressure in kids as well?
Yes, you can. You can see in
Okay.
kids. I don't do so much of pediatric cardiology. I leave it to
Okay.
my pediatric colleagues. But the cutoff for blood pressure for kids can be a bit different. The 140/90, which I'm saying, is typically for an adult, or,
Mm-hmm.
or even a teenage child of adult weight, 50 kg,
Okay.
45 kg. But for a 7, 8 year old, the cutoffs are lower for blood pressure. It should not be so high.
Got it.
And for kids, yes, I mean, low blood pressure, they're fainting all the time, the values are low, not meeting the appropriate cutoffs, it needs to be investigated. Although
Okay.
dehydration, you know how kids are, right? They don't drink enough and they
Mm-hmm.
run and they get giddy. So dehydration is still the most common.
Got it.
But sometimes if they're really abnormal, then we need to look for structural birth defects in the heart. So we are going down a different diagnosis making altogether.
Got it. And do we have, like how you said, right, different diagnoses? Do we have something in mind? Like, okay, let's try heart first, or like, do we have that set of steps that we go through, or we go via like how the symptoms are showing?
For evaluation of secondary hypertension,
Yes.
yeah. So of course, if they point towards a classical story of snoring, then the sleep study is the priority which I send them
Got
for.
it. Right.
If I mean, certain excess hormones like catecholamines and dopamine, this is a technical term, in excess can cause anger issues, can cause flushing of the skin. So if somebody describes that, I
Mm-hmm.
would do it. But most of the time, there's no clear one particular red flag that people describe. So I do what I call a cascade screening. I just send for everything, so that so that
Okay.
everything is covered instead of having to uh, make it a very long drawn process, do one by one. And most of it is either a urine collection or blood test. So I can do the blood test in one go, a urine collection in
Okay.
one go. So I don't need to keep repeating the blood test or the urine
Mm,
collections over and over again.
got it. And like I've been hearing a lot about sleep now. Like everyone, people talk about how sleep is important. Does it impact how, does it, like, obviously not, I'm talking in terms of hypertension right now. Does it impact how, like, our body is, like, with no sleep, our body's stressed out?
Yeah,
So does
it
it
does. It
impact
does. So I
hyper?
mean, I think the earliest sleep thing that we talked about was a physical airflow problem, sleep apnea. So these are
Right.
people who can go to sleep, perhaps maybe sleeping very nicely, snoring away, right? But that's a problem. But you're talking about insomnia, and you lie in bed, you can't fall asleep, you're always thinking about something.
Mm-hmm.
So insomnia is a mental health thing. That's how it can be classified, and that in itself can cause high blood pressure, especially if you're not very well rested. So
Okay.
yeah, so all this is a judgment. When I see patients, sometimes I do give them some sleeping pills to make them fall asleep, and
Okay.
once they do that, their blood pressure does get better also.
Okay.
Yeah,
Okay.
correct.
And sleeping pills are not, again, like they can get off once they're feeling better.
Hopefully, if they are not dependent on it. So sleeping pills are addictive. That one I have to tell you. So sleeping pills are addictive. I usually give them. I don't give them a 1 month supply. I give them for like 3 or 4 days. Only take
Okay.
as required. If they feel better and they can jumpstart the cycle and they don't need reliance on the medicines, it's good. But if they keep coming back asking me for sleeping pills, in Singapore at least, this is very well regulated. I would want to then refer them to a psychiatric colleague who can then
Okay.
really guide them through the medications, especially if they need it for long term, because there's addiction risk. And I need my
Got
psychiatric
it.
colleague to help with the holistic management of it. Because
Got it.
for sleep insomnia, it's not always about medicines. There's psychotherapy, sleep hygiene, labs that there
Mm,
are. Yeah.
got it.
Now, before I forget, the one last thing that maybe we should talk about is obesity and hypertension and losing weight. And there are a lot of medicines in the market now, which are good
Yes.
and very useful in helping you lose weight.
Mm-hmm.
Apart from your diet and exercise, these are medicines that work in the brain center, reduce your appetite. They reduce the transit of food out of your stomach. So you always
Mm-hmm.
feel full and you don't feel like eating anymore. And these are the GLP-1 things that we talk about. Brand names are things like Monjaro, Ozempic,
Yes.
tablets are things like Rybelsus. So there's some people who I start blood pressure medications for obesity. I even start these medicines so that they can lose weight and hopefully tail off some blood pressure medications.
Okay.
But these injections, unfortunately, are not a cure.
Mm.
So if you stop the injections, you can gain back weight again. You have to change your
Okay.
lifestyle from the exercise point of view. So a lot of interplay right now. A lot of interplay.
Yes.
All this cannot be done on one consultation. It's multiple consultations.
Yes, yes. And we've been hearing a lot about Ozempic, is in it talks, especially in Bollywood, right? We are seeing.
But that's for the appearance. But imagine now a patient's obese or high
Mm,
BMI or overweight, and they already have manifestations from the disease of being obese, high blood pressure. So these patients are really those that would benefit from that more than just those who have nothing whatsoever, but their wedding is coming up in like 3 months time and they want to lose weight fast. So this one I would be a bit more cautious in giving them the medicines.
so I know it's a bit of a controversial, but do these medicines have side effects as well?
They do so the side effects are mainly gastrointestinal. You
Okay.
feel nauseated because you always feel full. The stomach is not emptied out of whatever you ate from earlier. But that
Mm,
helps in how these medicines reduce your weight. You don't eat as much anymore. You feel nauseated. You can get constipated because the transit through the
Mm,
whole intestine is slowed down, right? So it just constipation can occur, and you feel
got it.
bloated. So some people don't like it. You're always burping because you feel bloated.
Yes.
But
Okay.
it's a small price to pay for weight loss for a lot of people, and they push through their symptoms and they get very happy.
Right.
Yeah.
Especially who need it, how you said, right? Like especially people who really need
Yes.
such kind of
Correct.
medicines. Wow, such important information. Thank you, Dr.
Welcome. Would you
Pinakin
like to share?
Parekh.
All this refreshes my memory and my advice, and make sure I give correct advice to patients.
Yes, yes. But before we let you go,
Yes.
is there any last tip that you would like to give to people who are listening to it and feeling, oh no, like we are on the medicines and, we are doing everything? Anything that you
I
would
mean,
like to
I just
share?
had a patient 2 days ago. Same thing, high blood pressure, and he's got some work stress. You cannot run away from that. He's got stress at home, also from family, and then he was asking me strategies to help with the stress. So one thing that came out as a joke was, okay, run away from stress, change the home, change the family members at home. But I think that was said in fun. But I think family support, if you have a good family support at home, where
Hmm.
you come home to people that you love, I feel that helps with your pressure management. You see your kids, you see your spouse, and that can help with the whole stress that you've had at work. So don't bring your work stress home, and they should not be reason for more stress in anything. They should be therapeutic. That's what
Right,
I
right.
just say to a lot of my patients.
Oh, this is such a nice advice. Thank you, doctor. Yes, I mean, just stay happy.
Yes, that's right. I think I've seen a lot of your podcasts about happiness and mental space. I think that's very important. It's not very well addressed. You should get a psychiatrist or some mental health expert to also be on your show to kind of explore these things. It'll be very useful for your audience.
Sure, definitely. Let me know, Dr. Pinakin Parekh, if you have any friends in
Definitely.
that area and would love to talk to me.
Sure, sure.
I would like to get them on this podcast for sure.
Okay, definitely. You take care, Neha.
You too. Thank you so much,
Thank
doctor.
you. See you, everyone. Bye bye.
Bye.